Hi there. So my name is Brittany Rodriguez, and I'm going to be talking about the profession of physician assistants. So what's a typical workday like? So for a PA, which is the career that I hope to get into in a few years, you're basically going to diagnose and treat illnesses, take medical histories, assist in surgery if that's the area of work that you chose, set fractures, and inform patients about their conditions and ways to assess and fix the problem at hand, regardless of what area of study you get into as a PA. So basically, PAs are an extension of a physician. They are there to help a physician pretty much do what a physician does, except for the exception of writing certain scripts for prescriptions like pain meds. So PAs are like a physician's right hand. They are going to be there to help them. A lot of times physicians get busy, whether it be with paperwork or they see so many patients a day, so PAs will jump in and help out with that workload. So a huge part of being a PA is the teamwork that you have with the employees around you. They are a major part of the medical profession. They work alongside physicians, nurses, respiratory techs, radiology techs, patient care techs, and many more. Where the work is going to take you. So with a PA, like I said, you're going to be working alongside so many different people, even more than what I spoke about. So as a PA, you can find work in several different settings, whether it be a hospital, an office, educational, or community health center setting. So there are a lot of different job opportunities as a PA, and the career just keeps growing year after year, so those job opportunities will continue to grow as well. Work hours will vary depending on the work setting that you're in and the specialization that you choose. So, for example, if you are a PA and you work in surgery, you may have a lot of call hours. So you have to take that into consideration. But of course, no matter where a PA works, they must work under a supervising physician. Again, a physician has to sign off on your work, and they also have to prescribe meds if you as a PA are not allowed to. But again, you could work 40-hour week if you work in a doctor's office or, say, for example, a dermatologist office, or if you work in a hospital setting, you could work 60 hours a week or more. So it's going to vary depending on where you're at. So as far as pre-PA education, so to initially get into PA school, what they're going to require is for you to have a bachelor's degree. So that way you can fulfill those prerequisites that you have to have for PA school. So some good majors to have in order to get into PA school would be a bachelor's degree in biomedical science, or a bachelor's degree in biological health sciences, which is what I'm actually into right now. Once you get your bachelor's degree, afterwards, you're going to want to take what's known as the GRE exam. That is the exam that you have to take before you enter a graduate program like PA school. They also recommend that you can take the MCAT, which is what you usually have to take before med school, but it's not required. Like I said, you can take the GRE, and that will be good enough. Also, patient experience hours are required before applying to PA school, so that's going to be any type of hands-on patient interaction. So some examples of that can be an EMT, a PCT, which is a patient care tech, medical assistant, and there are so many other opportunities as well. So for example, I've been an x-ray tech for 5 years, and that will count towards my hands-on patient interaction hours. Once you are through PA school, you're going to graduate with a master's degree as a physician assistant. And the PA school is a 2-year program. Basically, every school that I have looked at is about the same. It can be 24 to 26 months. Some schools will start in the fall, some will start in the summer. So it just depends on where you go, where you apply to. Once you are done with PA school, you're going to take their certification exam, which is the PANCE exam, I believe it's called, PANCE exam, and that is how you are going to become a licensed physician assistant. So some different organizations that are associated with physician assistants. One is called the AAPA, American Academy of PAs, and that is the National Professional Society. So this is something that you can join. It'll keep you up to date on any new PA medical news articles, how they're growing in the medical field. There will also be some information if there's any conventions going on for networking with other PAs. As well as any leadership and advocacy summits. The NCCPA, National Commission on Certification of Physician Assistants, that's going to let you know as far as the credits that you have to do, continuing education credits. So right now they're on a 10-year certification process. So every 2 years, a PA must submit 100 CME credits online. And that is required so that way you can keep up with your license and keep everything up to date. So here is my 5-year timeline. So basically, this is what I hope to go by. I want to be able to finish my undergraduate degree, which I'm doing right now, and hopefully be done by the end of 2020. That's what I'm hoping. And then I want to take my GRE exam as soon as possible. I'll go ahead and study a little bit for that and be studying for that while I'm still doing my undergraduate. As soon as I'm done with my GRE, I want to go ahead and apply for different PA programs, hopefully in February of 2021. I'll be working on the PA school applications. Hopefully I'll have some shadowing already done under some PAs that I've met through the hospital. And then May 2021 is when I hope to start PA school. Again, I'm going to send my applications out everywhere, so I don't know exactly where that will be. But I will be hopefully starting PA school then. That'll be 2 years into PA school, so graduating in 2023 with my master's degree as a PA. I'll take my certification exam in June of 2023, and then as soon as that certification exam is done, I'll start applying for a PA job in July of 2023. So that is my 5-year timeline. These are just my references of where I got all my information for this presentation. And thank you very much, and I wish everybody the best of luck with their career goals.